My name is Dr. Melvin Cannon, and I'm from New Age Chiropractic. And you can visit me at my website at drcannon.com. Today, we're going to talk about what people constantly ask me: what is a pinched nerve? Or, doctor, I have a pinched nerve. Or I went to my medical doctor or my chiropractor and they told me that the pain that I have in my neck or my back is caused from a pinched nerve. But unfortunately, they tell me that, and nobody seems to be able to treat it properly other than chiropractic, because the medics are just giving me, medication and nothing is being corrected. So let's talk a little bit about what a pinched nerve really is, so you will have a very good idea why chiropractic, and especially the type of chiropractic that I do, will really help. A pinched nerve is not really what it sounds like. You really don't have anything literally pinching the nerve, such as a bone or a spinal segment actually pressing on a nerve. Because if you did, you would be in really bad shape and you wouldn't be walking or functioning. So let's clarify that. And before we do that, let me explain to you a bit about the nervous system. So we all have a brain, I assume. Therefore, the brain is lodged in the skull, and the brain basically sends all the messages to all parts of the body and tells the body what to do. So we are really a big telephone system. The brain exits the skull and comes down your spinal column. And the spinal column is a group of 24 bones that encompass the spinal cord. It protects the spinal cord. The spinal column can move, it rotates, it goes front, it goes back, it goes side to side. And as the spinal cord, which is moving through and inside the spinal column, comes down from the neck all the way down into your low back, nerves exit the spinal column in pairs. So you have 25 pairs of spinal nerves exiting the spinal column. And they exit the spinal column through a foramina, which is like a hole on either side of the spinal column. These holes are made up of 2 half moons. And when the spinal column tends to shift right or left or up and down, this hole changes size, moves tissue around in it, and it creates various types of pressure. This pressure in this area of your spinal foramina where the nerves exit, this pressure creates pressure on the spinal nerve that's exiting. When you have pressure on a spinal nerve, and it's not bone touching the nerve, it's just really other tissue in the same vicinity that has become irritated, has become shifted, or you have muscles right and left of the spinal column which are pulling and causing the vertebrae to shift. This is what is called a nerve irritation, or in layman's language we call it a pinched nerve. These pinched nerves, or these nerves that are irritated, they exit the spinal column at various levels, all the way from the neck to the middle back to the low back, and they supply really your entire body with nerve energy. And this nerve energy is a message from the brain through the nerve into the muscle, into the body parts, whether it be your heart, your liver, your kidneys, or they go down into your back, and they go down into your low back, and they go down your legs. And when they get irritated or the nerves in the low back get pinched, you now have a problem with low back pain, or sometimes we have a severe problem which is called a sciatica or a sciatic neuritis, which I'm sure there are many people who have heard it and who have had it, which creates extraordinary amounts of pain.